This week, we're going to continue our discussion of developing interventions. Specifically, we're going to focus on consequence-based interventions. So these will be interventions where we are manipulating or arranging consequences to decrease problematic behavior. And we're going to specifically focus on the procedures of extinction and differential reinforcement. So just as a review from last week, we are working off of the process of completing a functional behavior assessment, which will produce results that tell us the function of the behavior. That is the reinforcer that is maintaining the behavior. So that will come in the form of social positive reinforcement, in the form of attention or access to a tangible item, social negative reinforcement in the form of escape or avoidance, or automatic reinforcement. The FBA also tells us the conditions under which the behavior does and does not occur. So we talked about those type of interventions last week, that being antecedent-based interventions, where we can manipulate antecedent conditions in an attempt to eliminate the probability that problem behavior will occur. So unlike those interventions, this week we're going to focus on the consequence end of that continuum. So we're going to skip past antecedent-based interventions and focus on consequence-based interventions. So this is yet another strategy for decreasing problematic behavior. So it would entail first identifying the reinforcer that maintains the problem behavior. Now, of course, the FBA process includes indirect assessments. We could do descriptive assessments, but we know those are unreliable for confirming the maintaining variable for the problematic behavior. We can't really identify the function unless we conduct a functional analysis. Once we've done that, and we know what the reinforcer that maintains problem behavior is, then we could begin to develop consequence-based interventions. That is, we can manipulate the consequences to either eliminate the reinforcement contingency for problem behavior, or we could arrange new consequences to compete with the maintaining reinforcer, or we could arrange consequences to reinforce appropriate behavior or an alternative behavior. Or we could arrange new consequences to reduce problem behavior. We're not going to talk about that this week. We will talk about it in the future. So if we look at our functional analysis protocol, which we've done many times already, we know that each condition, each test condition, the attention, demand, and alone, is a test for a reinforcement contingency. That is the reinforcer that maintains a problem behavior. And we have them listed here on the right. So when problem behavior occurs highest in one of these conditions, particularly relative to the play condition, or even perhaps relative to each other, we would say that the problem behavior is maintained under those reinforcement conditions. That is, the contingency that maintains the problem behavior is revealed by doing the functional analysis. So when we talk about interventions, we're specifically going to look at changing consequences. So again, this is just another option you can use. In fact, arranging new consequences for problem behavior is one of the more common ways to address or eliminate or decrease problem behavior. That's not to say that we will not explore antecedent interventions if we believe that they will be useful and effective. But you do see a lot of interventions based on adjusting the consequences. Now, one of the things that I think I mentioned either last week or the week before is this idea that ethically, as a behavior analyst or anybody working with individuals that are exhibiting problematic behaviors, we should try to treat that problematic behavior using the least restrictive interventions. And often in some organizations or some context, antecedent-based interventions are seen as the least restrictive approach because we're not sort of implementing like a timeout procedure or something like that. Sometimes consequence interventions are seen as sort of restrictive. That is, we're going to withhold reinforcement if the problem behavior occurs and present reinforcement contingent on some other response that's more appropriate. So in some areas I've seen, in fact, working with the state, these are seen as a little bit more restrictive of an intervention. So keep that in mind. But nevertheless, they are common interventions, and we're going to read quite a bit about those over the next couple weeks when you are presenting your articles on each of these interventions, as well as in ABA 511 and 512. So the first article I assigned was by Brian Iwata, and it was entitled, What Makes Extinction Work? An Analysis of Procedural Form and Function. So what I want to do is sort of outline the background of extinction, sort of by way of the article, and then we'll talk about the methods used in the article. So that'll sort of provide a research example as well as a clinical example. So when we say we are implementing extinction, it is essentially the discontinuation of reinforcement for a behavior that leads to a decrease in the frequency of that behavior. So, for example, if self-injurious behavior is maintained by social positive reinforcement in the form of attention, when we encounter the client engaging in the problematic behavior, we would not provide attention. We would withhold attention. If problematic behavior was maintained by social negative reinforcement in the form of escape, we would not allow the individual to escape. We would perhaps carry through with the demand or even physically guide them. So we're going to talk about all those procedural variations. So when we do this, there will be a result. When we withhold the reinforcement for a problem behavior, there will be a result. There's a probability that there could be a couple different results, and we'll talk about those. But the most desirable would be that the behavior decreases. That is, the behavior, if it decreases to 0 and stays at 0, we would say the behavior has been extinguished. And it's extinguished by severing the relationship between the behavior and the reinforcing consequence, right? So if I withhold the reinforcer, essentially what I'm doing is breaking that contingency, the behavior reinforcement contingency. So extinction is a little more complex than one might think. It's not simply ignoring behavior. Those of you working in classroom settings or maybe even some other settings where there's not a lot of behavior analysts working or perhaps no behavior analysts working, you may hear people utilize the term, well, we'll use, just ignore it, extinguish the behavior. It's not that simple because we have to know what the function is. So the variations of extinction are specifically based on the function of the behavior, right? We have to know what that is. If you think of the definition here, if we're going to withhold reinforcement for the problem behavior to implement extinction, certainly we need to know what that reinforcer is. Secondly, there are some procedural differences in what we're going to do or how we're going to implement extinction, either withholding the reinforcer or some other method. So we'll talk about each of those. So obviously the best result of extinction is the gradual decrease in the frequency of the behavior. There are some other negative side effects of extinction. The first one being what we call an extinction burst. This is an initial and temporary increase in some dimension of the behavior, usually frequency or intensity, during extinction, specifically when extinction is first implemented. So I often use the example of if you've used a vending machine in your office or school for a long period of time, and one day you go there and you put your money in and you select your favorite item and it doesn't come out, right? You end up going through this sort of process of behavior. Maybe you put the coins in again, make your selection. Maybe you try that 2 or 3 times, then maybe you kind of bang the machine a little bit or rock it. So when your behavior contacts extinction, you emit a temporary burst. And a better example, I think, probably more pertaining to the current time we're in, is if you work on a computer and suddenly your computer, your internet freezes, right? What type of things do you do? You probably click your mouse button, several times real fast, or you tap your keyboard repeatedly to carry out the action, whatever command you selected on a computer. So again, it's because the response of either using your mouse button once is not producing the effect. So therefore you kind of quickly tap 3 times before you figure out that, well, the computer is running slow, or it's locked up, or internet went down, or something like that. So that is a byproduct of extinction. It's commonly seen. It's not always seen, but it is important we understand that that can occur, because if we utilize extinction as a procedure, some folks may become very discouraged when they see that the behavior actually worsens during those initial couple sessions or couple days of extinction. There's other extinction-induced phenomenon, and that would be temporary increases in what we would call emotional responding. So maybe you see an increase in aggression or crying, or things of whining, things of that nature. So again, what happens with extinction is not only do you get a burst in the actual target behavior, but sometimes you get some what we call response variation, right? So think of it again like you're on your computer, your mouse button, you click it once to execute a command, it doesn't occur, and you have a long history of selecting that mouse button and the command occurs. So you sort of get this burst of the target behavior, clicking the mouse button, and then maybe some other behaviors like frustration. You get angry because what you've done thousands of times in the past are no longer working. So this can occur with extinction. Again, as I mentioned, we have the desirable effect of the gradual decrease in the frequency of behavior. So that does indicate that we don't see an immediate decrease in the behavior. It's not that you're going to implement extinction once and the behavior will disappear. This takes a long time. Again, you have to contrast it with the long history the individual has, a client has, engaging in that behavior and accessing that reinforcer. So you have to consider that. So they would have to, if you think of it in terms of sort of reprogramming the behavioral contingency, they would have to have sufficient exposure to all the stimulus settings in which they engaged in the behavior in the past under an extinction condition. Occasionally, you'll get spontaneous recovery. That is the temporary reappearance of the behavior following extinction. So here's a typical graph of extinction. We have a baseline phase where the initial behavior is at some stable level. So let's just say this behavior, whatever it is producing reinforcement. So it occurs at a stable level. Then, when we put extinction into effect, where this phase change line is, you may see initial burst of responding. Again, we have this long history of each time I engage in the behavior, a reinforcer is produced. Suddenly, I engage in that same behavior and there's no reinforcer. So I'm going to have a little burst, maybe some emotional responding, and then you get this gradual decrease. Right? Hopefully to 0 levels. Here's an example of spontaneous recovery. Now, I don't want to go into details about spontaneous recovery. We're going to talk about extinction in great detail in ABA 511 next semester. But if you know, with the knowledge you already have about behavior and contingencies and what we call stimulus control, you could probably begin to speculate why spontaneous recovery might occur. So let's imagine that the child lives at home with mom and dad, but occasionally, every once in a while, they see grandma and grandpa. And grandma and grandpa always reinforce the problematic behavior. But mom and dad are doing extinction, so they get the zero occurrence, but then the child encounters new stimulus conditions, one that have produced reinforcement in the past. So they may have a spontaneous recovery of the problem behavior. Hopefully, after they contact extinction again, the behavior will decrease. So let's look at the different forms of extinction relative to the maintaining variables. So the first one would be extinction for behavior maintained by social positive reinforcement in the form of attention. We typically call this planned ignoring, and the article presents that quite clearly. So you may hear the term planned ignoring. That is an extinction procedure, but only for behavior that is maintained by social positive reinforcement in the form of attention. So whether you call it extinction or planned ignoring, probably irrelevant, but it's an extinction procedure. It's an extinction-based procedure. So if we consider what can happen when problem behavior is occurring and how we as a therapist or any individual will withhold reinforcement depends on whether or not the reinforcer is absent versus present. So specifically what I mean by that, we'll explain it by way of example here. If a student disrupts the class to tell you that you smell and that you're old, right? If you're implementing extinction, you would do nothing. You would not say, hey, that's wrong, don't say that. You would not react. And that would be an extinction procedure. So in other words, the reinforcer hasn't been delivered, right? If problem behavior is maintained by attention, it's occurring to contact that attention reinforcement. So if the behavior occurs, you do nothing. You do not deliver the reinforcer. However, there could be other instances where you are delivering the reinforcer. Say you're speaking with that student, and then they tell you that you smell and that you're old. How would you implement extinction? Well, you'd probably stop speaking and walk away. So you're withdrawing the reinforcement at that point, right? So these are things that we have to consider procedurally what's going to happen. If the problem behavior occurs, we're going to withhold the reinforcer. But if we're already involved in delivering the reinforcer, then we need to somehow withdraw that reinforcement. So planned ignoring or extinction for behavior maintained by positive reinforcement would simply involve not delivering or withdrawing the attention as the reinforcer. Now, of course, we could extend this to social positive reinforcement in the form of gaining access to a tangible item. So in other words, if problem behavior is maintained by gaining access to the tangible item, if we see problem behavior occur, we would not deliver the tangible item. If the tangible item is already delivered, that is, the child already has the reinforcer, extinction may involve removing the reinforcer. When we think about extinction for behavior maintained by social negative reinforcement, we consider the implications of escape maintained behavior. So this form of reinforcement is sometimes called escape extinction. And kind of what we're talking about there is we are not going to allow escape, right? So problem behavior is maintained by social positive reinforcement in the form of escape. If the behavior occurs, we are not going to deliver escape. So again, you kind of have these procedural variations. So the first thing we're going to do if problem behavior occurs is not terminate the ongoing stimulation. So an example might be child has a worksheet that they're supposed to be working on. They tear it up during class. You as the behavior analyst or teacher would present another worksheet. if needed, sometimes we physically guide the individual to complete the task. So you may have picked this up through the description of a functional analysis, but sometimes if we are delivering demands such as, I don't know, tie your shoe, if a child's problem behavior is maintained from social negative reinforcement in the form of escape, and we tell them to tie their shoe and they bang their head, we may physically guide them to tie the shoe. So we take their hands, hand over hand guidance to tie the shoe. So they're not contacting the escape contingency. So therein is your term escape extinction. We're not providing escape. Obviously, if the reinforcer is not there, the stimulus conditions are not there, rather, we're not going to delay the presentation of the stimulation. So an example of that might be as you approach the child's desk with the worksheet, they engage in SIB. So in the past, maybe you said, okay, you don't have to, you turn away. Now we're going to continue approaching and deliver the worksheet. So they're not allowed to escape and or avoid the aversive, well, the presumably aversive stimulation of doing work. We'll talk about this later, but what if extinction for social positive reinforcement is applied to behavior maintained by social negative reinforcement? There probably would not be an effect. However, there are some circumstances where if you apply extinction inappropriately, it could worsen behavior. So we'll talk about those on a future slide. So the more tricky form of extinction is for extinction for behavior maintained by automatic reinforcement. We call this sensory extinction. Now, one of the challenges for behavior maintained by automatic reinforcement is that unlike social reinforcement, with automatic reinforcement, we don't have access to the reinforcer. So it's more difficult to withhold reinforcement, right? If a behavior is maintained by your attention, you can withhold your attention. If a behavior is maintained by escaping you delivering demands to your client, you could still deliver those demands where they can't escape. You would not provide escape. However, if the problem behavior is producing its own consequence, a sensory consequence, we don't have access to it. So how can you implement extinction? Well, it turns out there are a couple variations that we see in the literature, and one I've used quite frequently, and that is sensory extinction. So an example might be a child walks into rooms and they flick the light switches repeatedly, causing the lights to blink. How would you implement extinction for that, right? If the behavior of flicking the light switch is maintained by the light going on and off, you can go to the length, and I've seen families do this, of disconnecting the light switch, right? So suddenly the child flicks the switch, the lights no longer blink, so the sensory reinforcement is not there. And after several days, light switches are no longer interesting, right? That's kind of what we're doing. We're decreasing the behavior. Other examples might be, let's just say the child engaged in ear clapping behavior, right? So they have their open hands and they clap their ears, pretty intense and repeatedly. If that behavior is maintained by automatic reinforcement, we would have to sort of hypothesize what the sensory consequence might be and how we might implement an extinction procedure. So think about that. If we're looking at a behavior of hand clapping the ears, it could be that behavior is producing auditory stimulation, that is the sound that's made by clapping your ears. It could be some form of tactile reinforcement, the feeling of the hand hitting the ear, or it could even be the feeling to the hand. So even if we look at those two possibilities, that the hand clapping behavior produces an auditory consequence and maybe a tactile consequence, how could we attenuate those consequences? Well, maybe a big pair of earmuffs might do that, right? So suddenly the individual's clapping but they're hitting the earmuffs. So the auditory stimulation might not be there, and the tactile stimulation might not be there, thereby producing an extinction effect. So you see stuff like that being used. Helmets being applied, right, to break the contingency between stereotypic self-injury and a sensory consequence produced by hitting one's own head. Again, only if the behavior is maintained by automatic reinforcement. Another interesting example would be the way opiate antagonists work on people who are addicted to drugs, right? So the reinforcement contingency obviously is getting high. So if you consume an opiate antagonist and then you inject heroin or smoke heroin and do something like that, it doesn't produce the high. So the contingency, the reinforcement, has been removed. So the behavior reinforcer contingency is broken. So interesting work there. Okay, this comes out of the Iwata article, and these are the functional variations of extinction relative to the maintaining contingency for SIB. So if we look at behavior maintain, or SIB they're talking about in the article, but it could be any behavior. SIB maintained by social positive reinforcement in the form of attention. So if you have extinction attention, that would be considered treatment. It would work, right? Because you're removing the contingency of attention. If you provided escape, that would be contraindicated, meaning the behavior would worsen, right? So if you prevented escape from occurring, it may worsen the behavior, right? Because the contingency you need to break is is the attention. Extinction, sensory extinction would be irrelevant. Nothing would happen there. If the problem behavior is maintained by social negative reinforcement in the form of escape, and you're providing extinction in the form of planned ignoring, that would be contraindicated. It could worsen the behavior. However, if you apply extinction escape, it would be treatment. It would work. Sensory extinction would be irrelevant here. If the behavior is maintained by automatic reinforcement, both extinction in the form of attention and escape extinction would be irrelevant. Behavior wouldn't worsen, but it would not change either. Sensory extinction would work. So this sort of matrix here outlines, one, the requirement that we have to know what the reinforcement is, what the maintaining contingency is for the behavior before we implement extinction. Two, this highlights conditions under which the wrong application of extinction could worsen behavior. So Iwata actually set out to do that, and we'll talk about that article in a couple slides here. I do want to tell you that obviously, as you know, a big part of behavior analysis is understanding the terminology. The second part of that is being able to utilize that terminology appropriately, right? As a professional, all of you are working to become master's level behavior analysts, and that is a professional credential. So therefore, you need to have command of the terminology. And of course, most of you are in your first year, so I don't expect you to have full command of it, but certainly by next semester, we should start to see, even really by the end of this semester, you being able to utilize these terms appropriately and correctly, because that is the professional language. So with respect to extinction, you do hear a lot of misuse of terms. So some folks refer to the behavior being extinguished whenever any procedure is used, procedures other than extinction. So they may say, well, we've reinforced the appropriate behavior and extinguished the bad behavior. That's not technically correct unless you're utilizing extinction. So you want to make sure that when you refer to a behavior being extinguished, it is related to the application of extinction, not just simply that the behavior went away. Certainly do not use the phrases "we extinct the behavior" or "the behavior is extinct." That is not technically correct either. Forgetting is not an example of extinction. So you don't acquire information and then when you forget it underwent extinction. And there's a distinction between a procedure, which we are not talking about yet, called response blocking. Right? It looks like sensory extinction, but if you don't know what the reinforcement contingency is, simply blocking the responses is not a form of extinction. It is a common procedure though, right? So if somebody's engaging in self-injurious behavior or even aggression, we may utilize response blocking or response blocking with redirection. We block the self-injurious behavior, we redirect the behavior to something else. So not the same as sensory extinction unless you explicitly know that the behavior is maintained by automatic reinforcement and you're blocking the response to prohibit the behavior from contacting the reinforcer. I don't really want to extend on the discussion of non-contingent reinforcement versus extinction. But some folks would say that non-contingent reinforcement is a pure form of extinction because the reinforcement's there, it's just not contingent on behavior. So it does look similar to extinction. In extinction, there's no reinforcement for the behavior, and in non-contingent reinforcement, there's no reinforcement for the target behavior, but the reinforcer is delivered on a response-independent schedule. Okay, so the general considerations would be this, that the biggest advantage of extinction is it is a simple and direct method of response suppression or decreasing the target behavior. However, there's some pretty significant disadvantages. Some reinforcers are difficult to identify and or eliminate. It is slow acting, right? It doesn't have an immediate effect. There are potential side effects, right? The behavior could worsen before it gets better. And it doesn't directly establish an alternative response. I would add another disadvantage here, and that is generalization of treatment effects. So I'm always reminded of individuals I worked with when I was at the Kennedy Krieger Institute, where we could do on the hospital unit extinction quite effectively, right? You get everybody on that, all the staff on that hospital unit were able to implement extinction. But when you took the child or the client off that hospital unit down into the streets of Baltimore, and they engaged in these sort of disruptive or bizarre behaviors, it drew a lot of attention. So extinction is limited in its generality, right? Everybody who engages with the individual has to implement the extinction procedures appropriately. Okay, so that brings us to the Iwata article. I'm going to go through this quite quickly because I assign this primarily so you have an idea of these different extinction procedures, but it is an interesting article in terms of our understanding of extinction. So there are 3 participants with developmental disabilities, all of whom had similar topographies of SIB, but they were selected because their SIB was maintained by different sources of reinforcement. Sessions were conducted in therapy rooms. So in other words, this is a research study, a clinical research study. So these individuals were receiving clinical care, but the research was done in terms of identifying different functions of self-injurious behavior and how extinction would apply to each of those functions. Response measurements were individualized for each individual, but consisted of SIB, recorded during the percentage of 10-second intervals. Okay, for the experimental design, they first conducted a functional analysis, and that was done in a multi-element design. Then they assessed different procedures, different extinction procedures using a reversal design or a multiple baseline. So the basic sequence of events was they first conducted a functional analysis described by the procedures first identified by Iwata et al. In 82. Once they identified the function, and again, there were 3 participants, all of whom had different functions of their self-injurious behavior, they applied 2 forms of extinction. And again, the question here was, what if you apply the correct form? How would that work? Would it be most effective? And what if you applied a form that was not appropriate to the function? Would that have detrimental effects or no effect? So let's go through the results here. For Donnie, we see that his behavior, SIB, was maintained by automatic reinforcement, right? So this is a pretty complex graph, multiple baseline across different forms of SIB, and we see that his baseline levels were pretty high, right? In all of these baselines. When they implement sensory extinction, noted at the top here, we see pretty significant decreases in his self-injurious behavior. They reverse back to baseline and then go back to extinction. So this is sort of it is a multiple baseline, but also a reversal in that they confirm sensory extinction is very effective. Then they move to this procedure where toys are provided and they apply a helmet, sensory extinction, contingent on SIB. And you get this gradual decrease until problem behavior is eliminated. If you look down on the subsequent panels, again, you see sensory extinction is effective, but then they apply a different form of extinction, escape extinction, and that has no effect, right? Of course, they go back to sensory extinction and there's an effect. So you see that repeated, that sensory extinction is very effective. If you apply a different form of extinction, it is not effective. So again, this paper is just driving the point home that we need to know what the maintaining variable is to apply the right form of extinction. Here's another participant, Jack. His problem behavior is maintained by social negative reinforcement in the form of escape. They actually implemented sensory extinction throughout, but there really wasn't an effect to that. There is only an effect when they implemented escape extinction. So here you see the functional analysis baseline, problem behavior elevated in the demand condition. So we implement escape extinction. You see that extinction burst right here, and then a gradual decrease. They go back to baseline, and then they re-implement escape extinction, and we get this low-level problem behavior. Now, again, they implemented the 2 forms. Sensory extinction was implemented throughout. So if this had an effect, you would have seen it during this baseline here, and there was no effect. So again, it's important if the behavior is maintained by social negative reinforcement, you apply the right form of extinction. Here are results for Millie, whose SIB was maintained by social positive reinforcement in the form of attention. So again, similar to the others, they also implemented a form of sensory extinction. FA shows the problem behavior was maintained by social positive reinforcement. They implement extinction in the form of removing attention, so planned ignoring. You get that decrease, you go back to baseline, rates come back up, implement extinction again, decrease levels, and they also implement a differential reinforcement procedure in here. Now we'll talk about differential reinforcement shortly because we'll see that differential reinforcement procedures involve a form of extinction. The second article that was assigned was by Tim Vollmer and Brian Iwata in 1992, and it reviews differential reinforcement. So this article is what we call a review article. And at the time of publication, it reviewed all articles that had been published on differential reinforcement. So review articles are great resources for better understanding a particular procedure or subject within behavior analysis. So it is not a formal study per se, but it reviews formal studies. So that said, this article covers differential reinforcement as an intervention for problem behavior, and again, focuses on the functional variations. So what I want to do is just cover the basics of differential reinforcement, and then we'll sort of discuss some aspects of this review paper. Differential reinforcement entails reinforcing one response class while withholding reinforcement for another response class. And we use it to decrease problem behavior. So if we conceptualize what's happening procedurally, we are going to deliver reinforcement for some other behavior, right? Whether it is sort of a specific other behavior, which we might call an alternative. We'll get into these variations shortly, but let's just say for now, we're going to reinforce any other behavior except the problem behavior, right? So it's kind of like, let's catch the client being good and deliver reinforcement. But if problem behavior occurs, we're going to withhold reinforcement. So differential reinforcement entails extinction, right? Think of the term differentially reinforcing behavior. We're going to reinforce these behaviors, but not the problem behaviors. So the two primary differential reinforcement procedures used to decrease problematic behavior is differential reinforcement of other behavior and differential reinforcement of alternate behavior. So a DRO is a schedule in which reinforcement will be delivered for the non-occurrence of a target response or a target behavior. So what that means is we are going to utilize a schedule reinforcement, typically an interval-based schedule. And as long as a problem behavior does not occur during that interval, we will deliver reinforcement. We'll go through an example. So if I were to apply a DRO to try to reduce problem behavior, I would set up a schedule where I have a timer. And let's just say I set that timer for 1 minute intervals. So every 1 minute it goes off, it beeps. As a behavior analyst or the person implementing the DRO, I'm observing the child going about his or her day, doing whatever they should be doing, and that timer's running. As long as they do not engage in the target response, the problem behavior, during that 1 minute interval, when the timer goes off, I will deliver a reinforcer. We'll talk about what that reinforcer is shortly, but let's just say for now, reinforcement. So the interval continues, next interval continues. If they engage in problem behavior during that interval, no reinforcement's delivered. Right? And of course, the behavior is placed on extinction. So it's a schedule for delivering reinforcement, essentially for the absence of behavior. Now that's sort of interesting, and it goes against our definition of reinforcement, where reinforcement is applied contingent on some response that increases future probability of a response. So the question is, with differential reinforcement of other behavior, what behavior are we reinforcing? And don't let it keep you up at night, but essentially we're reinforcing any other behavior. So it's the reinforcement is delivered contingent on other behaviors that are occurring during the interval, as long as a problem behavior doesn't occur. In a DRA procedure, it's going to be a schedule in which reinforcement is delivered for the occurrence of an alternative response, right, or an alternative behavior. We've actually talked about DRAs already when we discussed functional communication training, because if you remember, functional communication training involves reinforcement for the occurrence of the functional communication response and extinction for the problem behavior. So that's what a DRA is. FCT just happens to be one specific alternative response, a communication response. Often DRAs are communication responses, but they could be other responses as well. anything that's appropriate. So we could set up a DRA for in-seat behavior, right? Where as long as a child is in his or her seat, we are delivering reinforcement, right? So it's an appropriate alternative to out-of-seat behavior. Now, the schedules often are a little different in DRA, particularly if we're talking about a functional communication response. It would be a ratio-based schedule. That is, when the alternative response occurs, we deliver reinforcement. So it's not time-based as it is with the DRO. It's typically ratio-based, and that is based on the occurrence of the alternative behavior. So the alternative behavior occurs, we deliver the reinforcer. Problem behavior occurs, we do not deliver reinforcement. So here's a grid that sort of indicates what's happening procedurally with extinction, DRO, and DRA. And as you can see, both these differential reinforcement procedures have an extinction component built into them. So with extinction, if the target behavior occurs, we withhold reinforcement, right? If no target response occurs, not relevant. Alternative responses are not relevant here. With the DRO, if the target response occurs, we withhold reinforcement. If no response occurs, we deliver reinforcement, or no target response, I should say, no problem behavior. With the DRA, if a problem behavior occurs, reinforcement's withheld. If an alternative response occurs, we deliver the reinforcer. So let's look at each of these procedures in detail, focusing on DRO first. DRO, again, is a scheduled reinforcement where the reinforcer is delivered contingent on the absence of the problem behavior. So really contingent on the occurrence of any other behavior but the problem behavior. And it is schedule-based, meaning we pick a schedule, a time-based schedule, an interval schedule. So let's just say a fixed interval, 1 minute, or it could be a fixed interval, 30 seconds if that's needed, or a fixed interval, 5 minutes. And we're delivering the reinforcer when the interval times out as long as a problem behavior did not occur. So the requirement for reinforcement could be based on no target behavior during the timed interval, or we could use what's called a momentary DRO interval. So those of you who are in 502 will remember momentary time sampling, where now we're just going to observe at the end of the interval. And if the problem behavior is occurring, no reinforcement. If it's not occurring, we deliver the reinforcer, right? So it's a momentary schedule. Obviously a little more easier to manage. So those are two procedural variations based on an interval or a momentary time interval. Other variations could be based on the consequence for the absence of the target behavior. Now, we're going to assume that we did a functional analysis and identified the reinforcer that maintains problem behavior. So when we set up the DRO, we can use that reinforcer to reinforce the other behaviors, the appropriate behavior, and withhold it for the problem behavior. So we call that the functional reinforcer, right? So in other words, I set up my DRO for let's just say this time I'm going to use a variable interval, 5 minutes. And on some variable schedule, if problem behavior doesn't occur, I could deliver the functional reinforcer. If problem behavior is maintained by attention, at the end of the interval, I will deliver attention. If problem behavior is maintained by escape, at the end of the interval, I will deliver escape. So that would be delivery of the functional reinforcer. However, we could also deliver an arbitrary reinforcer. Now, we haven't talked about identifying reinforcers yet, but we would do so via a stimulus preference assessment. And if we found a reinforcer that was potent enough to compete with the reinforcer that maintains a problem behavior, we could use that in our DRO interval. So, for example, if problem behavior is maintained by gaining access to your attention, we could set up a DRO where we're going to deliver not attention as a reinforcer, but the individual's highest preferred item. So let's just say the individual prefers M&Ms more than they do your attention. So we could actually deliver M&Ms contingent on the absence of behavior, right? So we have these two options for the consequence. We could deliver the maintaining the functional reinforcer or an arbitrary reinforcer. The thing that's critical here, and this will make more sense when we cover preference assessments and reinforcers, the arbitrary reinforcer has to be more powerful than the functional reinforcer. So we really can't arbitrarily pick it. We have to pick it using a formal assessment. Now, the last variation is a little more important and a little more commonplace, and that is setting up the DRO with an interval resetting feature. So what that means is if the target behavior occurs, that is, if the problem behavior occurs, rather than let the interval time out and not deliver reinforcement, we could immediately reset the interval. So case in point, if I have a DRO on a fixed interval 1 minute, I'm running that timer. If a problem behavior occurs at 30 seconds, I can reset the timer. So the 1 minute starts over again. The benefit of doing that is if we don't reset the interval, that means the interval times out, the individual does not earn reinforcement, and then they have to go another, in that case, 1 minute to have an opportunity to earn the reinforcer. So it's sort of a longer absence of reinforcement if somebody does not contact the reinforcer. So we want to make sure that we're, again, stacking the deck in favor of success. And the interval resetting feature does that. So once problem behavior occurs, you reset the timer. Now the individual has to go another 1 minute. So we would run these DROs across an entire day. So for example, in some of the settings I worked, we used DROs quite a bit. And as the behavior therapist at the time, I guess what now we might call the BCABA or the RBT, I would have a timer, maybe clipped to my belt loop. I'd have reinforcers if we were using tangible reinforcers, and a data sheet. And I would follow the individual around during my shift. So we would do, if they had to go to school, I'd be with them in school. And every time that timer went off, my job was to say, hey, great job, being good. And I would deliver the reinforcer. If the individual engaged in a problem behavior, I reset the timer. And you'd have to do this during all waking hours, right? To ensure that there's a therapeutic effect. Now, of course, initially we want to set those DRO intervals to be very dense, meaning there's going to be a high density of reinforcement delivered for the absence of problem behavior. However, that gets unwieldy, or it's difficult to manage that. So we want to make sure we can thin the schedule of reinforcement. We'll talk about that a little bit later. So the advantage of a DRO is it is relatively easy to implement. The disadvantage is it doesn't specifically strengthen appropriate behavior, and failure to meet reinforcement could actually increase the target behavior over time. So with a DRA, there are a couple procedural variations. First, the procedural variations of the alternative behavior. So that is, what is the alternative behavior? And you'll see in the literature, as well as the Volmer article, there are some distinctions made between DRA, or what we call a DRI, differential reinforcement of incompatible behavior, and a DRC, differential reinforcement of compliance. These distinctions are not particularly important. They may be helpful in terms of indicating what form of differential reinforcement of alternative behavior is being used, but essentially all of these reference an alternative behavior. So for example, a DRI, incompatible behavior. Well, let's think of how that might be applied. if an individual engages in a behavior such as hand mouthing, right? That is, they stick their hands in their mouth repeatedly or continuously, and there's hygiene issues, there's issues to the mouth. It's a problematic behavior. So if it's stereotypic and it's automatically maintained, we could set up a DRI wherein on a schedule of reinforcement, we reinforce an incompatible behavior. So for example, both hands contacting a toy. As long as the individual has his or her hands on the toy, reinforcement is provided. If the hands are in the mouth, no reinforcement. So we're calling it an incompatible behavior, but it's still an alternative response, an appropriate response, an alternative to the problem behavior. Same with DRC. So if compliance is a problem, we could differentially reinforce compliance, right? So non-compliance is placed on extinction. Compliance results in reinforcement. So although there are distinctions in the terminology, procedurally, they're kind of the same in that we're reinforcing an alternative response. So again, similar to the DRO, the consequence for the alternative behavior could be based on the functional reinforcer, or it could be an arbitrary reinforcer. Generally speaking, with DRA, particularly in the form of functional communication training, the alternative response typically results in the functional reinforcer. So for example, if problem behavior is maintained by social negative reinforcement in the form of escape, we could teach the individual to communicate for escape, let's say using a picture card. So when they exchange a picture card, that results in an escape period, a brief break, let's say 30 seconds or 2 minutes. Then we continue on. So that is a functional reinforcer. But again, we could use an arbitrary reinforcer. So I do want to underscore, generally with DRA in the form of functional communication training, we use a functional reinforcer. It's typically with DROs that you see an arbitrary reinforcer being used. So the big advantage of a DRA is that we are replacing a target behavior with an alternative behavior, an appropriate alternative. And we would say that behavior is functionally equivalent, right? That is, it can produce the same reinforcer as the target behavior. Now, again, sort of extending into a brief discussion on our ethics as a behavior analyst, there's sort of these general guidelines that if a client is engaging in problem behavior, it is our job to eliminate that problem behavior. However, that problem behavior is functional for that individual, meaning, even though it's problematic, they learn to do it because it's functional. It gets them something that they desire. So therein, we are sort of ethically bound that if we're removing that problematic behavior, we should replace that behavior with something more appropriate, right? So DRA fulfills that clearly. So it's a nice procedure in that approach. There really are no disadvantages other than the primary disadvantage of any behavioral intervention being there's labor involved, right? We're not a pharmacological approach. So that means we have to do something different. Our behavior has to change the individuals, our individual clients' behaviors. So the last thing I could say about DRA, which I probably stated when we discussed functional communication training, is the fact that it is the go-to intervention, right? Because it is so flexible. If problem behavior is maintained by social positive reinforcement or social negative reinforcement, we could come up with an alternative appropriate response quite easily, and it would replace problematic behavior. So the first thing we need to consider when we select either DRO or DRA is the initial schedule of reinforcement. Now, DRA is quite easy because I discussed it being on a ratio schedule. So let's focus on that first. If we're utilizing DRA, we want to stack the deck in favor of the individual succeeding, right, or contacting reinforcement. So let's spend a little bit of time talking about that. Again, extending into sort of these more ethical discussions of treatment. Our goal is to obviously improve the life of the individual by decreasing their problematic behavior. Another way to look at that is we are increasing their access to reinforcement, right? That is something you and I strive for in our daily lives, whether you think about it technically like that or not. We are probably always striving to have a reinforcing life, that we have access to the things we want and desire. So with the DRA, initially we start on a very dense schedule. So if problem behavior is maintained by escape, and I teach the individual to communicate for a break instead of engaging in the problem behavior, initially I have to reinforce each one of those responses to get it to occur and maintain, but also to strengthen it to the point where it replaces the problem behavior, that the problem behavior has undergone extinction and the alternative behavior has been shaped and maintained. Once that occurs, then I could begin thinning this schedule, because an FR1 is a dense schedule, right? And it would be hard to implement for a long period of time. So let's go now to a DRO schedule. Selecting the initial DRO schedule takes a little more planning. So I have here that the schedule should begin at a mean that is slightly less than the baseline inter-response time. What does that mean? Hopefully you remember from 502 that the inter-response time is the time between two responses. Well, if we've done several baseline observations and we record the appropriate data, we could determine on average what is the time between responding. So let's just say that we do the IRT calculation and we determine that the average inter-response time during baseline is 30 seconds, right? So that means the problem behavior is at such a high rate, on average, there's about 30 seconds between each instance of problem behavior. So if we're going to do a DRO and we want it to be effective, we need to start with a schedule that is less than 30 seconds. So let's just say we go with 10 seconds. So that means every 10 seconds, if no problem behavior occurs, we're delivering reinforcement. Now, I've worked with individuals where we have to use that dense of a schedule. Now, as a behavior analyst, we are trained to implement these procedures, so we could probably do that quite easily. For everybody else, that is way too difficult to do. I cannot imagine a teacher or a parent doing all the things they have to do while simultaneously providing reinforcement every 10 seconds. So therein, the job of thinning becomes important. We have to first run this into this DRO schedule to the point where problem behavior is eliminated, or at least very low, and that maintains under our initial schedule. Then we could begin changing that schedule, going from, say, an FI 10 seconds to maybe an FI 30 seconds. After some period of time, we can maybe go to an FI 1 minute, maybe even an FI 5 minutes, maybe even a VI 10 minutes, right? So moving from a dense schedule to what we call a lean schedule, and then one that is manageable in the natural environment. So that is the initial approach. I kind of described thinning a DRO, right? The thing I want to point out is you want to do this gradually. It is typically systematically done based on a percentage of a decrease from the problem behavior, or in the problem behavior rather, for some period of time. So I often go something, I would say something like this. We will thin the DRO schedule contingent on responding, that is, less than 5 instances per day for 3 consecutive days, right? If based on my data collection, I will know if the individual has met that objective. If they have, then I can thin the schedule reinforcement more. If they don't, then maybe I continue under the same schedule, or if behavior worsens under that schedule, I step back to a denser schedule. So again, this is one of those areas where, as behavior analysts, we are relying on our data collection. We are relying on and analyzing those data to determine how we adjust our interventions. DRA thinning is could be thought of as a little easier, but there are a couple interesting options here. The first one, I think we described both of these when we discussed FCT, but the first one would be a delay to reinforcement following the alternative behavior. So that is, the individual engages in the alternative behavior, and rather than delivering the reinforcer immediately, we say, hey, good job asking for a break. You need to complete one more math problem before you get the break. Or, hey, great job asking for my attention. You need to wait 2 minutes before you get attention. So we're in a sense, we're sort of delivering a little bit of reinforcement in terms of the attention. But we're also teaching the individual that you can't always get what you want when you immediately ask for it. You need to wait. So again, we'd want to do this systematically in small steps to ensure the individual can succeed. The next way of thinning a DRA schedule is using a multiple schedule. If you recall from the discussion of FCT, this would be where we literally have stimuli in the environment at a basic level, colored stimuli, so a red card and a green card. And we teach the individual, when the green card is present, if you communicate, reinforcement will be forthcoming. When the red card is present, your communication responses or your alternative responses are not going to be reinforced. Okay, so those are some of the basics of thinning those schedules. Of course, we're going to talk a lot about these interventions again in ABA 511. So even though I'm kind of going over them generally, I want you to have a very basic understanding of what each of these are, and specifically how they would be implemented for a given function of a targeted behavior. Some other considerations that are discussed in the Vollmer article include differential reinforcement for automatically maintained behavior. Again, we have that challenge of gaining access to the functional reinforcer. If it's automatic, we don't have access to the reinforcer. So it's hard to implement extinction. Obviously, we could do some form of sensory extinction, or we may utilize an approach where we're delivering the arbitrary reinforcer, right? So remember, one of the variations of DRO, or DRA for that matter, is we could deliver an arbitrary reinforcer. So imagine an individual's problem behavior like hand mouthing is automatically maintained. Maybe it's the sensory stimulation of saliva on the hand or the hand in the mouth. We don't know. But we could either use a DRO where we deliver some sensory reinforcer on a schedule, or we could teach the individual to communicate for access to that sensory reinforcer. I believe that next week or the week after, we're going to talk about what's called a competing items assessment. So we'll have a discussion about this approach shortly. Other things that the Vollmer article describes are forms of differential reinforcement for negatively reinforced behavior. Now, I actually already went over these. That is delivering escape on a time-based schedule with a DRO, or delivering escape or break based on a DRA. So the Vollmer article uses the formal terms differential negative reinforcement of other behavior, differential negative reinforcement of an alternative behavior. While those are technically correct, you almost never see those terms used in practice. So I just put that out there in that, for all I know, it could be on the BCBA exam. I doubt it, though, but nevertheless, if you see something like this, you'll have an idea of what is meant by a DNRO or DNRA. Okay, that is it. That was quite a bit on interventions. Certainly we'll discuss these when we have our virtual meetings, so be prepared to have some idea about each of these interventions. Have a great week.